Chronic pain is the largest public health crisis in the country. It's greater than cardiovascular disease, greater than diabetes or cancer, and the cost of chronic pain is over $600 billion a year. I appeal to you, Chairwoman Missy Irvin, and members of the committee, please help us with this crisis. Chronic pain can be defined as pain that persists most days or every day for 6 months or more. Over 100 million U.S. citizens report that they experience chronic pain on a daily basis. It's the number one reason that Americans access the healthcare system, and chronic pain is the leading cause of long-term disability in the U.S. Chronic pain is associated with reduced quality of life, having great effects on physical functioning, including ability to perform ADLs and on sleep. Chronic pain has a great effect on physiologic morbidity, including depression and anxiety, anger, and loss of self-esteem. Chronic pain has social consequences and affects relationships with family and friends and work colleagues. All of this can result in social isolation. Chronic pain also has societal consequences with increased healthcare costs for all with disability and also loss of work days. Treating pain with opioids has been an effective treatment because opioids block messages of pain to the brain and decrease the body's perception of discomfort. The surge in opioid prescribing can be traced back to the 1990s when patients' complaints of pain were identified as the fifth vital sign. By 2010, widespread opioid use and addiction reached a crisis point, prompting a multi-front counterattack by providers, regulators, and law enforcement agencies. The opioid public health emergency was nationwide and impacted health, justice, and child welfare systems. In 2011, the Department of Health implemented the Prescription Monitoring Program as authorized by Act 304, which gave access of prescription data to authorized personnel and required providers to check the PDMP for Schedule 2 and 3 opioids. Act 820 required this to be posted to the website. Additional requirements include signed pain contracts, baseline urine drug screen, random urine drug screen, and pill counts, and patient evaluation every 6 months by a physician. Informed consent with discussion of benefits and risks of opioid management need to be documented in the patient record as well. In 2016, the CDC reported outlined new parameters for prescribing opioids on a chronic basis. Experts concluded that more than 50 morphine meal equivalents per day, roughly 2 15-milligram extended-release oxycodone tablets, increased overdose risks without offering pain control benefits. In the primary care setting, a provider can write an opioid prescription for a 7-day time period, and then if necessary, the patient must be referred to pain management for chronic treatment with opioids. However, it can take several months to get into a pain management clinic, and the patient often returns to the primary care clinic for treatment. The PCP is compelled to provide appropriate care for the patient, all the while under review by the prescription monitoring system. The provider is in the middle of the mandated rules for providing appropriate care, and at times patients are not given pain management after surgery just because of the pressure of the review by the monitoring system. Finding alternative treatments is best when treating chronic pain. However, most of these are not affordable to patients. Many are not reimbursed by insurance as well, and therein lies the problem and the point at which a change must be made, because every day that an individual is not able to work, they are at increased risk for disability, which is a burden to our economy. Although there are recommendations to use alternative treatments to opioid pain treatments, there's been no provision to pay for these alternative treatments because many individuals with chronic pain are not working. They have less money to pay for these treatments, and many are way too expensive for them to afford. Physical therapy is an effective treatment for pain. It is often covered under insurance, but it is very expensive and usually has a copay. Being prescribed 2 to 3 sessions per week, many patients cannot afford and often refuse to continue the recommended therapy because of this expense to them. There are other helpful pain remedies, including pain cream, heating pads, cold packs, but these are seldom covered by insurance, if at all. Over-the-counter pain creams and compounding creams are very expensive, And many people have to choose between paying their bills, eating, or purchasing the pain creams, and they choose to not purchase them. The TENS unit is about $200 per unit, and massage therapy is $50 to $90 per session. These are effective, but they're not covered by insurance for home use. Pain medications are often the most affordable, which makes them appealing and which may have contributed to the opioid crisis. People with injuries or conditions that are no fault of their own continue to be in pain. An intervention to fix the opioid crisis was implemented and may have helped with the addiction of opioids. However, it did not offer an alternative plan for pain relief for those who have chronic pain. I urge you to make an alternative therapeutic pain treatment affordable for people of all income levels. Compounding pain creams, TENS units, massage therapy, and heating pads are therapeutic and would likely provide some pain relief. The implementation of the prescription monitoring program did not offer an alternative to this. Multiple therapeutic treatments like heating pads are effective for longer periods of time with no requirements of monitoring kidney or liver function, which is an additional cost to the insurance companies. Treating pain with opioids is a temporary treatment, but treating pain with alternative solutions treats the whole patient, and not just the tip of the iceberg. Chronic pain impacts us all, and treating pain effectively with alternative therapies without the side effects of sedation and altered mental status with the opioids would offer the chance for individuals to go back into the workforce and be a productive member of society, reverse the negative feelings of isolation, and the cost of health care would be reduced.